Hi, everyone. Thank you for joining us today for our webinar on how to support parents and caregivers with the WIC program. Before we start, I wanted to introduce your presenters, myself and my colleague, Alexander. My name is Juliana Pereira. I'm the Child Nutrition Programs Manager at Hunger Free America.
And my name is Alex. I am working with the Child Nutrition Department at Hunger Free America through the AmeriCorps program.
Now, to give you a little bit of background on our organization, Hunger Free America is a nonpartisan national nonprofit group working to enact the policies and programs needed to end domestic hunger and ensure that all Americans have sufficient access to nutritious food. Our work spans a lot of different departments, such as data analysis, where we manage data on food pantries throughout the country. We also operate the USDA National Hunger Hotline and field calls from people all over the country on food assistance resources near them. Our advocacy, policy, and research department does quite a bit of work in terms of providing policy recommendations and advocating for the best policies for Americans to access food. And we also have a very strong strategic volunteerism arm that equips us with talented and experienced volunteers to help increase our capacity. Lastly, we have our benefits access team, which is largely based in New York City. Hunger Free America is our kind of affiliated group. They serve low-income New Yorkers with support and education for accessing nutrition programs, and it is part of the larger Hunger Free America organization. So the purpose of today's training is to provide we're going to take quite an active approach towards the WIC program, towards the application and understanding of eligibility. We really want to arm you with a working knowledge of all the different components that go into the program so that you are ready to answer questions and alleviate any concerns that parents may have. We recognize that you as parent leaders within the school system, you have a lot of really valuable connections that are super trustworthy with your parents, and we hope that arming you with this information will be the best way to connect with potentially eligible parents and children. Today, you're going to learn working knowledge of WIC, what it is, how it functions, as well as who WIC is for. We'll provide a basic criteria that indicates whether a person, a child, family may be able to access this program. We'll also talk about what WIC is for, why WIC is a good program, what it can do to support families. Then we'll get into how to identify and engage with potential WIC participants by answering their questions and assessing eligibility. And lastly, we will inform you where to refer potential WIC participants for additional support.
Thank you so much for getting us started, Juliana. So what is WIC? First of all, we're going to talk a little bit about the absolute basics of the WIC program. WIC is a unique program that's both a public health and a nutrition program. So it has components of assisting families with food and also with healthcare. It provides supplemental food packages tailored to a family's needs, breastfeeding promotion and support, nutrition counseling and health education, as well as referrals to other health and social services. WIC is for young families, which includes pregnant parents, breastfeeding parents, postpartum parents, and this includes parents who are postpartum due to a successful birth or C-section, as well as parents who had an abortion for any reason or stillbirth for any reason. This also includes babies, infants, and children under the age of 5, and caregivers of eligible babies and children. The first thing that we're going to talk about that WIC provides is food, which is one of the first things that people think about when they hear about this program. WIC provides purchasing power to buy healthy foods such as infant cereals, yogurt, fruits and vegetables, whole wheat pasta, brown rice, 100% juice, other whole grain products, canned fish, peanut butter, and other foods like that that have a high nutritional value and are really good for young kids or breastfeeding parents. For a list of all the up-to-date WIC foods, we have some resources that we're going to share as well that are going to show you the list of approved foods and also the WIC food guide. And when we talk about these lists of eligible foods, WIC state agencies are going to tailor a food package for each individual participant in WIC. So participants are going to go in for an appointment, they're going to meet with a nutritionist, and based upon their needs, their health status, how old the kids are, whether the parent is breastfeeding, whether the parent is pregnant, cultural preferences, they'll work together to create a package of groceries, a grocery list for the family that's taking part in the program. Another piece of the WIC food package is the cash value voucher checks, which is a program that was created in 2007. It expanded the WIC food basket to give Americans more access to fruits and vegetables, to meet dietary guidelines, and to help people have more nutrition in their diets when using the WIC program. These checks are issued monthly, and they're to be used for purchasing only fruits and vegetables, but also any fruits and vegetables that a family chooses, whether that be fresh fruits and veggies or frozen, canned, or dried, which are also highly nutritious and really important aspect of people's diets. There's two levels of the cash value voucher generally. The level for children is at $9 a month, and the level for parents is at $11 a month. However, currently, due to COVID-19, children are allocated $24 a month. Pregnant and postpartum parents are allocated $43 a month, and parents who are currently breastfeeding can receive $47 a month. Additionally, there is the Farmers Market Nutrition Program checks, which is another program that really emphasizes getting fruits and vegetables and nutritious foods into the bellies of WIC participants. This program is also great because it helps support local agriculture and farmers. It was passed in 1992 with the aim of achieving these two goals, so increasing participants' consumption of fruits and veggies, and also increasing awareness of and support of local agriculture. The FMNP booklets contain 5 coupons, each valued at $4, and each family receives 1 booklet per participant of 9 months of age or older who is receiving a food package. And these can be used at authorized farmers markets, farm stands, and as well as some mobile markets. Markets like this will have signs like the one pictured at the left that will indicate to participants that they can use their FMNP booklets at that location. WIC also provides nutrition education and counseling, so this is another big piece of the WIC program that makes it a really special program. Families and participants of all kinds work with nutritionists to help develop an understanding of healthy lifestyle habits, and so that parents can learn about cooking healthy, delicious meals for their families, how to identify healthy foods when shopping, what's best to eat during pregnancy and breastfeeding, and what foods are best for babies and growing kids. WIC can also help connect families to other healthcare that they may need, which is really a really awesome service and a really great opportunity for families to have somebody on their team and connecting them to the healthcare system. This can include prenatal, obstetric, maternal, and pediatric care, dental care, help quitting smoking or drug and alcohol abuse, as well as immunizations and vaccinations for kids. And connecting families to healthcare can help pregnant parents get prenatal care earlier, moms deliver healthier babies, and can help kids be healthier by getting them the healthcare and the vaccinations that they need.
Now I'm going to talk a little bit more about the history of the program to provide a bit of context around what the program is trying to achieve and how it's come to be the way it is now. So in 1967, during his presidential campaign, Robert F. Kennedy started visiting the Mississippi Delta and Appalachia, and he witnessed a lot of poverty and hunger in our country, which was at the time thought to be the richest, most industrious country in the world. His message was to bring the people to Washington, and Martin Luther King Jr. embarked on the Poor People's Campaign to create a multiracial coalition of poor people to demand federal funding for full employment, a guaranteed annual income, anti-poverty programs, and housing for the poor. This was just the following year. The year after that, in 1969, St. Jude's Children's Research Hospital in Memphis, Tennessee, enrolls thousands of local infants in a successful nutrition program, which will serve as a prototype for WIC. According to their research, 25% of low-income children in that Memphis area were anemic, about 1/3 having parasitic infections, and about 10% with growth impairments. Clearly, the health of the infants in that area was super negative at the time, and they had to intervene. So Dr. David Page of Johns Hopkins University in Baltimore, he creates a voucher program that provides iron fortified infant formula to populations like these high risk, low income mothers at public health clinics, because they recognized many of these issues were related to the child's early development in utero, well, yes, the fetal development in utero. So this program was known as IFIF, Iron Fortified Infant Formula Program, and this serves as the second prototype for WIC. Then we have the White House starting to pay attention to hunger and poverty in the United States. The first and only, to this day, White House Conference on Food, Nutrition, and Health is convened at the end of the year in 1969. It lasts 3 days. This conference leads to many things, including the nationwide expansion of food stamps, which is now known as SNAP, the Supplemental Nutrition Assistance Program, and the creation of the Special Supplemental Nutrition Program for Women, Infants, and Children, which we know as WIC. A few years later, WIC is passed into law, sponsored by Senator Hubert H. Humphrey. I apologize for the noise. It begins as a 2-year pilot program with an appropriation of $20 million a year. In 1975, legislation establishes WIC as a permanent national health and nutrition program. It would be administered by the USDA, the U.S. Department of Agriculture, a division called the Food and Nutrition Services, but be carried out by the states through a network of clinics and agencies at the local level. And you can see this awesome photograph from an early WIC clinic.
All right, so where do we stand currently with how WIC functions? So the USDA is still in charge of creating the national standards for WIC across the country. And then here in New York State, the Department of Health is the agency that administers the program and is responsible for operations across New York State. Lower than that, each county in New York State, including the 5 boroughs in New York City, contain a network of local agencies, including health centers, medical centers, hospitals that provide WIC services. From the perspective of participants in WIC, one of the most essential pieces is the e-WIC card. Previously, participants would receive books of checks when they participated in WIC. I'm sure almost everyone has heard of them or seen these checks, these sort of WIC checkbooks before, but within the last few years, WIC has begun to upgrade to operating on an e-WIC card system. This card works just like a debit card. It's super convenient for participants. They can buy food whenever they want, whatever works for them within their 30-day cycle of benefits. There's one card issued per household that includes the participants for everyone in that household. And these benefits are loaded every month, and then participants can purchase their food in multiple goes whenever they would like. They can share their card with other people. So they can choose to share their card, for example, with grandma. If grandma is the one who has the time to go and do shopping, she just needs the e-WIC card and the PIN, and then she can go and pick up food for the family. So it's a really much more convenient way of doing it. Here's an example of that benefits package or household shopping list, which both refer to this list here of foods that have been picked out by the participant and their nutritionist as part of their package for the month. Benefits will receive a shopping list each month that contains all these benefits. And as you can see on this example, this particular participant is receiving 16 ounces of cheese, 2 dozen eggs, and they can bring their card and their list, or they can bring their card and ask to have a copy of their list printed and purchase these items at a participating supermarket or deli or bodega in their neighborhood.
So Alex just covered some of the amazing benefits of the WIC program and how it works. I'm going to dive a little bit deeper into eligibility and how to apply and participate in the program. So we like to use something called a pre-screening checklist just to screen for general eligibility. At the kind of base level, to get WIC, the applicant or their child must live in the state where they apply. And also remember that citizenship or immigration status is not required to participate in this program, as well as screening for eligibility. There is no risk associated with that. The first category is categorical eligibility, meaning only pregnant, postpartum, breastfeeding parents, as well as infants and children under 5 years old are considered eligible participants of the program. Once that's been squared away, we can look to verify their income to make sure that it suits the requirement of the program. The first way and most easiest way we can do this is through adjunctive eligibility. So if the applicant is already enrolled in a program such as Medicaid, SNAP, or TAMP, they're automatically eligible for WIC. This is because they've already gone through the income verification process to participate in any of those other programs. And so it makes it a little bit easier to access these benefits more quickly. If an applicant is not enrolled in any of those programs, then we check two things: the household composition as well as the household income. The composition, the number of people in the household determines exactly how much the income can be. It must be under 185% of the federal government's poverty guidelines for that household size. As I mentioned, categorical eligibility has to do with being a pregnant parent. So you're eligible for WIC for the duration of the pregnancy and up to 6 weeks postpartum. As Alex mentioned, the postpartum also includes in the case of an abortion or a miscarriage. If you've had a successful pregnancy, then breastfeeding parents as well are eligible for WIC up to 1 year postpartum if they're breastfeeding at least once a day. And we mentioned that also comes with breastfeeding counseling and other related services. Postpartum parents, I went through that. And then infants and children are eligible for WIC up to 5 years of age. And the idea is that once they hit 5, they'll be entering into the school system and accessing school meals, summer meals, other types of nutrition assistance programs in that way. Adjunctive eligibility is the automatic income eligibility. It's based for participation in several of these programs: Medicaid, TAMP, which is Temporary Assistance for Needy Families, and SNAP, Supplemental Nutrition Assistance Program. The household composition can be flexible, which is one of the wonderful details about WIC. So they define a household as one individual or a group of related or unrelated individuals who are living together and who share income and the consumption of goods and services. So it doesn't necessarily have to be related by blood, related by marriage. They'll ask questions like who lives at the address, who is paying for the food and living expenses, who shares the living expenses. As we mentioned, caregivers are also included and can apply for their eligible children. So while they wouldn't necessarily receive a food package or those services, the eligible child that they apply on behalf of would. The last piece is household income. As I mentioned, WIC requires that the applicant's income is under 185% of the federal government's poverty guidelines for the household size. An unborn child can be counted as a member of a household. So a pregnant mother with a 1-year-old child would be considered a household of 3. And if she makes $30,000 a year, you can see that she falls well within the parameters of qualifying for WIC. Foster children are considered an independent economic unit, so they would be automatically eligible to participate.
Now we're going to talk a little bit about how you as a parent leader can connect families to this program. So first of all, how do we talk to people about WIC? How do we start a conversation? The most important thing is to be willing and ready to talk about this program with everyone. I think it's really difficult to identify specifically, oh, this kid needs to be part of this program, this family needs to be part of this program. You never know who could be eligible, you never know who could use this sort of support. So the best tactic is to just be ready to spread this information and share it with your friends, with your family, with your circles at school. If you're leading any sorts of events or groups, mentioning that WIC is available and that you are available to help guide people through the process to everyone in the room is the best way to make sure that this information is reaching the ears of the people who need it, and also making WIC a program that is part of common knowledge, part of everyday communication within the school community, and isn't something that's stigmatized and makes people feel less than for needing the support of. When you are talking about WIC, some talking points that you can mention are that when people are pregnant, they need vitamins and minerals more than ever to help support the healthy growth of a baby. Good nutrition during pregnancy, as well as in the first years of your child's life is vitally important, both for the mother or the parent who is pregnant or breastfeeding, as well as for a young child. The first 2 weeks of a person's life are the most important and the most significant. So really celebrating that with people and emphasizing the importance of parenting during these first few months of a kid's life is really important and a really exciting opportunity for them to be working on supporting their kid to the best of their ability. And also research shows that parents who use WIC have healthier births, and children who use WIC do better in school. So it's just overall a great supportive program that helps people thrive. We also wanted to mention specifically talking about WIC and the public charge, because a lot of families are very, very concerned about accessing benefits and accessing support if they're concerned about public charge, and if they're concerned about whether or not looking for support is going to affect their status as immigrants or their status as people seeking a green card or seeking citizenship. So very, very, very important. Public charge rules were overturned in March of 2021, which means that immigrant families are now eligible to receive WIC without it having any negative impact on their immigration application, if that's something that they're interested in doing. Many immigrant families remain fearful and misinformed, which makes a lot of sense. There's been a lot of fear mongering and a lot of negative rhetoric, and also up until March 2020, it was a risk for families to get involved in these sort of public support programs. But currently, WIC is not part of the public charge. It's probably not going to be anytime in the future, because what happened before March 2021 was very irregular given the overall history of WIC. So no one will be denied legal status for participating in WIC, and non-citizens are also eligible for WIC. This is one of the things that makes the WIC program special. And SNAP is not a program that's available to non-citizens, but it is a program that will not affect people within that process and their public charge status. So that's just a side note that's worth keeping in mind. Mixed status households are eligible for WIC. And when you're having conversations with families who are wary about applying for the WIC program for these reasons, you can use positive messaging like the example that we have here, which is applying for federal programs like WIC and SNAP can help you access resources like food. These programs will have no immigration consequences for you or for anyone in your family. This is a risk-free benefit. And we just think that's really important for people to hear. And here we have an example of the WIC pre-screening tool, which is on the website of the USDA. This is a great tool if you want to have a little extra support with helping somebody figure out if they might be eligible. The eligibility requirements can be confusing. They can be confusing for families who are considering applying, and they might be confusing for people like parent leaders who are trying to guide them through this process. So if you go to this link, which we'll have in the information for this video, this will give you an opportunity to go through the pre-screening tool in a variety of different languages and help people determine if they're eligible, which is a great way to make sure that you are supporting people and figuring out whether this is the program for them, and letting them know that they might be eligible for this program and they should take the next step.
Now I'm going to talk about several ways which you can apply for WIC or refer parents who you think may be eligible for WIC. The first way to apply would be online through the WIC Strong website. You can complete the full application online. from the comfort of your own home, if that's what you choose to do. You can also call the Growing Up Healthy hotline at the number below, or call 311 and ask to be directed to the nearest WIC location. So there's a few options. In person, you can apply at a WIC local agency. We'll provide a list of New York City WIC clinics and the information. And the last way you can apply is with us, from a specialist at Hunger Free NYC. As I mentioned, our benefits access department supports clients in the application and eligibility process with recertification. And I'll talk a little bit more about reasons why it's great to apply with Hunger Free NYC. We field new applications and really make sure that because we have such great relationships with the local WIC agencies, there's minimum waiting time, and there's not a lot of fallout from completing applications. We're able to do that in an expedited process because we have these great relationships and really are specialized in this work. We also provide referrals to other services. As Alex mentioned, that's one of the benefits of WIC, is being able to connect with other resources. In our case, in-house, we do one-on-one SNAP support, but we can also refer to other services such as food pantries, soup kitchens, and other programs like rental assistance and other things that may be of benefit to families. We provide remote and in-person services, and currently all of our WIC benefit specialists speak English and Spanish, and we also have access to translators as well. Overall, we serve as advocates for our clients, and that really helps them feel supported throughout the application process. And yeah, it ensures that we have successful enrollments in the program. Again, I just wanted to provide this contact information. This is contact information that you could give directly to parents if they're interested in learning more about these programs. We're going to provide a little flyer and some other outreach materials that would include basic information about the program and where to get extra support. So thank you so much for joining us today to talk about WIC and to talk about how you can help connect parents to WIC. It is a super important program, especially for immigrant families, and it provides a really wonderful health and nutrition component that we think many families could benefit from. So thank you again, and thank you to my colleague Alex for joining us as well.